Bismillahirrahmanirrahim. Now, my dear student of second year class, today we are going to start with the respiratory system, the histology of respiratory system. You all know this system is concerned for the gaseous exchange, that is the carbon dioxide and oxygen. Carbon dioxide is eliminated and oxygen is absorbed by the alveoli. Now this slide is the anatomy of the respiratory system, comprised of starting from the nasal cavity up to the alveoli. From the nasal cavity, the nasal cavity, its roof, floor, its lateral wall, and then is the nasopharynx, upper larynx, then trachea, divides into primary bronchus, secondary bronchus, tertiary bronchus, and terminal bronchiole. And then this is the gaseous exchange unit. Over here you see the capillary plexus, and then the alveoli, the gaseous exchange, are going to be transported across. And these are the two lungs encaged within the thoracic cavity. Below is the diaphragm. The lungs are covered by the pleura. Now, what is the introduction? The introduction of the respiratory system comprised of two parts: the upper respiratory passage and the lower respiratory passage. This diagram is the upper respiratory passage, that is the nose, pharynx, and the larynx. Up to the trachea, this is the upper part of the components of the respiratory system, which only act as a conduit or a pipe conveying the incoming inhaled air to the respiratory part of the respiratory system. Now you see nose, then the oral cavity, then nasopharynx, then upper larynx, epiglottis, then this is the upper part of the trachea. So this is the components of the upper respiratory tract. Now this is the detailed components of the respiratory system, starting from the trachea, divided into principal bronchus, and then the lobar bronchus, segmental bronchus, then the bronchioles, and then the alveolar ducts and alveoli. So these histology will be discussed according to the region, according to the parts of the components of the respiratory system, starting from the nasal cavity up to the last, that is the alveoli. We will discuss one by one, along with the changing in the histological pattern in the respiratory system. Again, the component, two parts, the conducting part and the respiratory part. So we will have to memorize the two difference. The conducting part only is the conduit or a pipe through which the air passes onward to the respiratory portion of the lungs. So over here the gaseous exchange takes place. Now, what is the function of this conducting part? Conditioning air, adjustment of the temperature, humidity, purification, cleaning, and dust removal. So these are the important function, because the adjustment of temperature, the incoming air, उसका temperature adjust करना है. Humidity is provided because of various these are the mucus secreting glands. They will also produce the humidity as well as secretion, purification and cleaning of the dust removal because of the cilia and then of the goblet cell. They help in the purification as well as removing the dust particle toward the exterior. What is the role of respiratory part? It starts from the respiratory bronchiole, alveolar duct, and alveoli. The three parts of the respiratory system: respiratory portion, respiratory bronchiole, then is the alveolar duct and the alveoli. Function of this is the gas exchange between blood and respiratory passage, minimize damage against foreign particles. The upper part, that is conducting, is the nasal cavity, nasopharynx, larynx, trachea, principal bronchus, then is the lobar bronchus, segmental bronchus, bronchioles, and terminal bronchioles. These are the pipe where the no gaseous exchange takes place. Now, structure we will discuss one by one, including histology, but the variations are there in the structure as well as the region. The epithelium is thickness, cilia, goblet cell variable, but the epithelium remain, that is the respiratory epithelium, that is the pseudo-stratified ciliated columnar epithelium most of the time, but it goes on varying according to the terminal part of the respiratory portion of the respiratory epithelium. Lamina propria will be also present in all the layers. Some mucosa is present, but also show variation. Cartilage, it is also present, but at some places it is absent. Smooth muscles are there altogether in the whole system of the respiratory pathway, but it is also sometimes absent in the distal part of the respiratory system. Now we will discuss one by one all these events of the histologies. The nasal cavity, you all know that nasal cavity is made up of nasal septum, nasal cavity, concha, the lateral wall, and the epithelium is the pseudostratified columnar ciliated with the roof, that is the nasal olfactory epithelium, is a concern for the sense of smell. Turbulence airflow areas increase, but between the humidity as well as the air is humidified, temperature is regulated within the nasal cavity. The hair's vibration is the very important step through which the larger particles that is get trapped within these vibration and they are evacuated out. This is again a safety measure in the nasal cavity. This is diagrammatic presentation of the nasal cavity. You see multiple concha and meatus. This is anormic discs. This is the frontal air sinus. Now these are various types of opening within the middle meatus and then the inferior meatus. This is the cut section. This is the orbital cavity. This is the maxillary sinus. So these are the three conchas and meatuses along with the nasal septum. What is the histology of the nasal cavity? Shown this the typical picture, the histology of the nasal cavity. The epithelium is typical pseudostratified ciliated columnar epithelium with many goblet cells. The lamina propria is quite obvious, which is the respiratory tissue layer having abundant of venous plexus. Veins are prominent along with nerve plexus. Connective tissue elements. Connective tissue element, that is the fibroblasts, are also visible. Why the veins are more numerous? Because of the humidification of the incoming air. Along with the, when it is the concha, it is the bone. So bone, that is the spongy bone, will be also visible in the deep layer of the lamina propria. So epithelium you will have to mention, that is pseudostratified columnar ciliated with many goblets. Cilia is also there, which is concerned for the propulsion of the mucus or any other particles out from the nasal cavity. Now what are the pharynx and larynx? The cartilage are the laryngeal cartilages, which are the island cartilage, except the epiglottis, which is the elastic cartilage. The mucous membrane is again covered by the pseudostratified columnar epithelium on the larynx side, on the trachea side, but on the pharyngeal side of the epiglottis you see the stratified squamous keratinized epithelium also visible on the epiglottis. Epithelium is pseudostratified respiratory side, stratified squamous for oral side. Also, this is the diagrammatic presentation of the part of the pharynx as well as the larynx. The pharynx is the only muscle, constrictor muscle. The larynx is the cavity as well as its opening and continuation of the trachea. Now this is the epiglottis important slide. The cartilage is elastic cartilage, D-shaped chondrocytes along with the elastic framework in its lacunae. The epithelium is double, that is toward the respiratory side it is pseudostratified columnar ciliated with goblet cell. Whereas on the tongue side it is stratified squamous epithelium. So this is the toward the oral cavity or toward the tongue, This is stratified squamous epithelium, whereas this is the lower, that is the laryngeal side. This is the pseudostratified plumbal epithelium. In between is the cartilage. The lamina propria is also visible, containing blood vessel as well as all the components of the connective tissues present in this. This is the elastic cartilage, which gives the added elasticity of the epiglottis for its characteristic function, that is diversion of the fluid particle and the air particle accordingly. Now, what is the trachea? The trachea is the windpipe starting from the lower part of the larynx up divide into the principal bronchus. So it is the epithelium is the pseudostratified plumbar ciliated, and cartilage and the muscle. The cartilage are the 6 to 20 C-shaped cartilage ring, and these C-shaped rings are deficient posteriorly, which is the trachealis is covered posteriorly as a smooth muscle which bridges the posterior ends of the trachea. It is called as trachealis, which is a smooth muscle. It controls the diameter of the trachea, this trachealis muscle. Between rings is the fibroelastic tissue allow expansion. Now, if you have to draw the trachea, अगर आप trachea draw करनी है, first of all you will draw the epithelium, then the cartilage. The cartilage is hyaline cartilage. This is diagram. The hyaline cartilage in the inner is the stratified, pseudostratified plumbar ciliated. This is the lumen. This is the lamina propria, and posteriorly this cartilage is deficient, and this deficient cartilage is covered by trachealis, which is a smooth muscle that control the caliber of the trachea as well as the extension, expansion. The fibroelastic tissue is also present prominently in the lamina propria. Now, this is the tracheal histology. Look at the picture, that is the pseudostratified plumbar ciliated, lamina propria very vascular. Then is the tracheal gland and submucosa, the hyaline cartilage visible in this diagram. This is the high power microscopic picture, the pseudostratified plumbar epithelium with many gallbladder cells. So all the secretion that is deposited within the trachea is due to because it's expulsion of all the mucus, and movement of the cilia will expel out the mucus through the oral cavity and nasal cavity. So it is very important function that these mucus secretion glands, that is the gallbladder cell, play an important role because it trap and also give the immunity. Assalamu alaikum. जी वालेकुम अस्सलाम. जी हो जाएगा इंशाल्लाह. जी हो गया, आ जाएगा इंशाल्लाह. So the tracheal histology, the important role of this the mucus secreting gland, that is the gallbladder cell, visible in this diagram also. Cilia give the propulsion movements from this mucus toward exterior. The trachea is give the support and patency, that is the cartilage is providing support as the patency of the lumen of the trachea. The glands also pour the secretion within the lumen. Now, what is the histology of primary, principal and main bronchial histology? The epithelium again is the pseudostratified plumbar ciliated with many gallbladder cells. Cartilage are interconnected plates. Now, this is the chain. The cartilage become now dispersed in the form of plates, scattered plates, but they are interconnected plates, not in the uniform C-shaped cartilage. Smooth muscles are also present beneath the lamina propria. Some mucosa, pseudomucous glands. This is the primary principal bronchus up to main bronchus. So only change is epithelium is the same. Smooth muscles are present in the lamina propria because now these smooth muscles will also contract and relax and maintain the patency as well as the lumen of this principal bronchus, and also help in evacuation of the various secretion. Some mucosa is also containing the pseudomucous gland. Now the bronchial histology, epithelium similar to trachea, shape and arrangement of the cartilage, smooth muscles are different. मैंने पहले बता दिया. With decrease in diameter, cartilage ring become irregular, isolated plates. Smooth muscles of the lamina propria are spirally aligned, lymphocyte and lymphatic aggregation in the lamina propria. This is the characteristic changes which visible in the bronchi. Epithelium same. Arrangement of cartilage is different. Smooth muscle prevalent. Then the diameter is decreased. Cartilage is irregular, isolated plates. Smooth muscle in the lamina propria, spirally arranged. And also the important lymphocytes and lymphoid aggregation for protection of the incoming air. Segmental or tertiary bronchioles, the epithelium is the same, that is the trachea, but the less goblet cell. Over here now, the goblet cell now starting vanishing. The goblet cells are present. Initially, there are all the principal bronchus, then segmental bronchus, but at the level of tertiary bronchiole, they all going to vanish goblet cell. Smooth muscle become prominent. Over here, all the activity depends upon the smooth muscle present in the lamina propria. Less submucosa, seromucous gland, दोनों जो हैं वो submucosa भी smaller in size, gland become less in number. Few isolated cartilage plates. Now the cartilage plates now start vanishing in the tertiary bronchi, although scattered one or two plates of cartilage hyaline present in this segmental tertiary bronchi. And this is the histological pattern of a tertiary bronchi. Look at the picture. The epithelium is pseudo-stratified columnar, but few goblets are absent goblet cell. Wavy in pattern, lumen is prominent. The lumen is prominent, and look at the picture that the cartilage plates are scattered in the islets, like islets in the lamina propria. This is the cartilage plate, this is a cartilage plate, this is again a cartilage plate of hyaline. So this is the typical picture of a tertiary bronchiole. Again, the slide of a tertiary bronchiole in the longitudinal section, pseudo-stratified columnar respiratory epithelium with goblet cell, very few. Although the cilia are present, lamina propria is containing more numerous lymphocytic aggregation. The cartilage are hyaline cartilage, which are in the form of plates isolated. Now these are the various types of blood vessels, bronchial arteries, but the glands are also present, but very few. Smooth muscles are also present in the lamina propria. Bronchiole diameter is 1 mm or less, control the airflow. Now bronchioles are the end part of this conducting pathway of the respiratory system conducting pathway. Diameter is 1 mm or low, control the airflow because it is literally supplied by the smooth muscle fiber. Epithelium is ciliated simple columnar epithelium. Now the epithelium change in the bronchiole. So over here the epithelium is simple ciliated columnar epithelium, no goblet cell. Again, the important cell that the CLARA cell starts appearing in this epithelium. Prominent smooth muscle in the lamina propria. This is the important feature because this will regulate the lumen of the bronchiole for the inflow of the air in the bronchioles. No cartilage, no gland. No cartilage, no gland. This is again the change, but the prominent feature is the ciliated columnar epithelium with CLARA cell. Smooth muscles are prominent, no cartilage, no gland. Look at the picture of this respiratory bronchiole, or rather bronchiole. The epithelium is simple columnar epithelium with cilia. You see smooth muscles are prominent in the lamina propria, although lymphocytes are present, but there is no cartilage, no gland. No cartilage, no gland, so only the presence of smooth muscle prominent. The epithelium is simple columnar epithelium with cilia along with the CLARA cell. CLARA cell is again an important cell which is concerned for the release of surfactant, which is coming in the next slide. Now, respiratory bronchiole. Now this is the respiratory part going to start from where the gaseous exchange may take place. Although still not, because of the epithelium is still ciliated cuboidal. Now the epithelium become thin out. The cuboidal epithelium, the ciliated cuboidal, no goblet cell, CLARA cells are present, no cartilage, but determinate amount of smooth muscle is present, no submucosa. The epithelium is now changed, that is ciliated cuboidal epithelium, CLARA cell but no goblet cell and no cartilage. smooth muscles become less prominent in this circulatory bronchiole. Now alveolar duct and alveoli. So this is the alveolar duct and alveoli. This is the true respiratory passage from where the gases exchange may take place. So epithelium is simple squamous epithelium, elastic and reticular fiber, elastic recoil and prevent overexpansion. Over here, epithelium is altogether changed. The epithelium is simple squamous because to minimize the width of the respiratory barrier. So over here, epithelium simple squamous, elastic and reticular fibers, the elastic recoil. These elastic fibers and reticular fibers form the main framework of the alveolar system. Elastic recoil, these elastic fibers are meant for elastic recoil and then prevent the overexpansion. Smooth muscle only at the opening of the alveolar duct. Only location at the opening of the alveolar duct, no other way that the smooth muscle are present. Cigarette smoking break down this alveolar tissue and repair of the tissue, which is called as emphysema. So cigarette smoking over here is the clinical application that this elastic and reticular framework is disturbed by the cigarette smokers. That is why the emphysema is the abnormal expansion of the lung parenchyma. Now, alveolar duct where the gases exchange takes place. Several cell types are visible in this alveolar duct and alveoli. Squamous alveolar cell type 1, 97%. Desmosome tight junction present, prevent leakage of tissue fluid. इसमें आपको alveolar duct alveoli में most of the time the type 1 alveolar size 97% will be present. So these cells are joined by tight junction, and as for desmosome, they prevent the leakage interstitial fluid within the space. Now, the other types of these cell type 2, which is surfactant releasing, only 3% present in the alveolar duct and alveoli. This surfactant is meant for the reduction of tension, surface tension. These are the round cell can proliferate and produce new type 1 and type 2 cell. Respiratory distress syndrome in mature baby is visible in this picture. So this is due to the absence of the surfactants, which is released by the type 2 alveolar cell, which is present only 3% in the alveolar duct alveoli. But these can proliferate to produce type 1 and type 2 cell both. Acute respiratory distress syndrome is the well-known entity in the clinical application, where there is the less activity of this type of type 2 cell, releasing less amount of surface tension, that is producing the respiratory distress syndrome, where the baby cannot breathe properly and there is accumulation of fluid within the alveolar sacs and ducts. Now, the important CLARA cell in this picture, you see the CLARA cell is the cuboidal type cell which have no cilia on the surface. Columnar type non-ciliated. Look at the picture, it is having a multiple numerous granules in the apical zone, the nuclei are basal side, no cilia over there, cuboidal type. What is the function? It's degrade toxin and inhaled air, divide to regenerate the bronchial epithelium, produce surfactant like material. 3 function: toxin removal, टॉक्सिन को रिमूव करेंगे और डिवाइड करके अपने पेरेंट सेल जो है 1 and 2 alveolar cell बना सकते हैं. It is the mother cell also produce surfactant like material, it is called the CLARA cell. Look at the picture, high cuboidal, round nucleus, apical granules in the cytoplasm, no cilia. Now interalveolar septum. This is a very important structure from where the whole mechanical aspects of the gaseous exchange will take place. Now this is the structure which is present between the 2 alveoli. Now interalveolar septum is the part of histological pattern between the opposing wall of the alveolus is called interalveolar septum. If I want to, this is the interalveolar septum, this is interalveolar septum, this is interalveolar septum. What are the contents of interalveolar septum? Now look at the picture. Interalveolar septum, it consists of the epithelial lining of the alveolus, then is the reticular fiber, elastic fiber, and then the presence of the type 1, type 2 pneumocytes, and then the presence of the blood capillaries and the dust cell, also called as macrophage. So all these are the contents of the interalveolar septum. Type 1 pneumocyte, these are the squame-like cell. Type 2, it is a bit rounded or cuboidal cell. Then the dust cell also present, and the capillaries also. These are the components of the interalveolar septum, which is the septum which intervene between the blood vessel and the alveolus, is called the interalveolar septum. Now look at the picture. Is the interalveolar septum in detail with the H&E stain. Look at the picture. So how much thinness of the wall, that is this is the capillary plexus, only the endothelial lining with the endothelial cell cytoplasm. Now this is the alveolar type 1 cell nucleus. How much thinness of this is the septum between the air and the blood vessel. Alveolar type 2 is a bit rounded and larger cell. Although in this no visible of macrophages, but you will have to memorize interalveolar septum, type 1, type 2 cell, then the blood capillaries and macrophages and reticular fibers are the components of the interalveolar septum. Now this is the picture to show you the alveolar macrophages in the interalveolar septum. These are the dust cells, which are the heavily pigmented cell. Nucleus is larger, the cytoplasm is basophilic, and these macrophages are also called as dust cell, play a key role in the scavenging or prevention of the incoming dust particle, injurious material, which are concerned to engulf and then destroy this. Now this alveolar duct and alveoli epithelium and the interalveolar septum. So alveolar capillary is also visible, interalveolar septum. Type 2 pneumocytes over here visible, whereas the type 1 alveolar epithelium, that is again a very squame-like cell which prevents the meant for the gaseous exchange. What is the over here? It is very easy to describe the alveolar and blood gas barrier. This is the picture. If the two epithelium of the capillary and that of the base membrane of two epithelial fuse, which that form a thin barrier. Now this is the blood capillary which is surrounding a alveolus. Now look at the picture. This is the respiratory alveolar duct. Now this is the alveoli. This is a thin layer of the type 1 cell. So this is type 1 cell along with type 1 cell cytoplasm with the basal lamina. The basal lamina of the epithelium, basal lamina of the endothelial wall of the capillaries, and the capillary cell cytoplasm, that is the endothelium. So this is the very thin barrier through which the gaseous exchange can freely take place between the capillaries and that of the alveolus. So this is called as blood gas barrier. Alveolar epithelial, that is type 1 and type 2 cell, basal membrane of the epithelial cell, basal membrane of the capillary endothelium, and the cytoplasm of the endothelial cell is the barrier of the blood gas barrier. This is the high power hypothetical diagram to show what is the blood air barrier. Now this is over here is the alveolar lumen of the alveoli. Now this is the type 1 epithelial cell membrane, the basal lamina on which the cell rests. Now this is the over here. Now look at the picture, that this is the alveolar epithelium. This is cytoplasm. This is the cytoplasm of the type 1 pneumocyte, a type 1 alveolar cell. This one is the fused basal lamina of both the endothelial cell. This is the cytoplasm of the endothelial cell. This is the nucleus of the endothelial cell. Now cytoplasm, and this is the basal lamina, fused basal lamina of both endothelial cell and type 1 alveolar cell of the alveoli. Now this is the lumen of the capillaries having erythrocyte. So this one is the blood air barrier. This is the blood air barrier. Type 1 pneumocyte, endothelial cell, lumen of the capillary, and the lumen of the alveoli. This is the this is surfactant layer over here. The surfactant layer lining of the type 1 cell. This will prevent the collapsing of the lumen of the alveoli. This is the barrier. Endothelial cytoplasm fused by the lamina. This is cytoplasm of the type 1 pneumocyte. Then is the surfactant layer. This is the barrier between the capillary plexus and that of the lumen of the alveoli. For gaseous exchange takes place over here. Carbon dioxide is moved toward the endothelial cell and the oxygen is moved toward the alveoli. So this is the barrier plate, which is very thin. Now this is the table will give you the detailed changes which takes place in all the layer of trachea, bronchiole and alveoli. So it is given in all the books. You can study by yourself various components, that is mucosa, epithelium, then क्या changes आती हैं, smooth muscle में क्या changes आती हैं, सब mucosa में, cartilage में. You will have to study in your proper way by various books and by very help of internet policies. Thank you very much. So this is all about the today's lecture.